I'll move. I will second.
Second by Milty. All in favor say aye.
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 Oppose? Approval of, or do I have any discussion on that? Then I have approval of the July minutes. Do I have a motion, or yes?
I approve the July minutes.
Do I have a second?
I'll second.
Second. All in favor say aye.
Aye.
Oppose? Any discussion on any of the minutes? Any questions?
No.
Then we're going to move to citizen input. Do you want me to let them speak first or read the letters first? Okay, so we will go with the first citizen input. And I have I'm sorry, is it SER or SEV? Okay, sorry, it was, okay. Would you like to come up and speak? Thank you.
Good morning, everyone. My name is Servando. I live in Kewaunee. I am just recently graduated from St. Norbert as a biomedical scientist. The reason I'm here today is to talk about the importance of wearing a mask and also the requirement that we have so far on teachers having to go back to school and then not having an option to stay home
Can you
and teach from online.
back up a little bit because you're hitting it and yeah, thank you.
Okay. I'm not sure if you're able to hear me now. Better. Okay. Just a little bit about me. I'm a firefighter and I'm an EMT, and I've seen COVID patients, and they're young, and they're old. We know the highest risk group is people who are older. We know that children are usually fine with this, but the thing is, children are also carriers. So even though children will most likely be fine, when they come home to their parents are at a high risk of getting the disease, and the transmission will skyrocket that way. So it's important for them to be wearing masks in school, but it's also important for the children and their parents to be able to decide if they would like to do hybrid classes, and some schools are. I think almost all of them now are switching to that. But the other option too is to make sure that they're able to make sure that the teachers have the option to stay home and teach from home online. At this point, the schools that I have talked to are not doing that, and that's just an issue that we have to address. The other thing too is, wearing a mask does not make you any less, powerful. It doesn't make you weak. It's a sign of respect also to our fellow citizens. The purpose of wearing a mask is to capture most of, in simple terms, to capture most of the spit. You're not going to carry everything, but the most important thing is to realize that there's this thing called the viral load. And the viral load basically means how much of virus you get into your body. We want a low viral load so that our body doesn't have as many complications as someone who has a high viral load. It's just the same thing as if you ingest a drop of gasoline, you're probably not going to get too sick. You're going to feel nauseous, but you're going to get over it. And that's what we want. But if you don't wear a mask, it's equivalent to, possibly drinking a whole gallon of gasoline where you can have a lot of complications. So there's so much data behind this that doesn't come from the CDC, that doesn't come from the World Health Organization, that comes from independent journals, scientific journals that are peer-reviewed. So there is no political agenda behind those journals, and the facts have always been the same. And this isn't just recently, it's been the past 10 years. The data has been there for a long time. And we've been using masks, and they've been effective. So, wearing a mask is not going to prevent this, but it at least slow things down to the point where we are able to manage it. Thank you.
Thank you. Jamie, can you come up?
I'm Joan Lisanski. I'm a board member.
Oh, Joanne, I'm sorry. I thought it said Jamie.
So, good morning, everyone. So, yes, for anybody who doesn't know, I'm Joan Lisanski, and I'm a board member. I've been a friend of Servando and his family for a few years. I do feel think of Servando as a relative of mine. And we've been having a lot of discussions. We were originally going to come to try and get the mask advisory enforced, and then gratefully, Governor Evers made it mandatory. So I just want to support him in talking about when the schools open up and giving teachers that option of teaching from home. I know my grandchildren are pretty much refusing to go to school. They want to be homeschooled. They actually excelled when they were off. So I'm going to be tutoring them. So I would like the teachers to be given that opportunity to not have to come in and teach. If you're saying that it's my choice if I wear a mask or not, then it should also be, if I'm a teacher, it should also be my choice if I'm going to teach in the school or not. I know this is a maskless community. I know I've been going many places where I'm the only one wearing a mask, proudly doing so. I know my daughter goes to work the only one wearing a mask and is talked about. So hopefully that is changing, and hopefully people listen to the voice of reason.
Thank you. At this time, I also have two people that wrote in, so I'm going to read this to you. One is from Lauren Schumacher. My name is Lauren Schumacher. I've been a teacher at Luxembourg Casco High School since 2015. We teachers now know that we will be returning to campus during the 2020-2021 school year. There is nothing more that I want than to be in my classroom doing what I love and serving my students. I am writing to you because I'm disappointed and concerned with Ms. Kinnard's stance on the mask usage, that there is no need for a mask update. I know many others will be providing articles that state why or how masks work to prevent the spread of virus, but I like to share my personal story to remind those listening at open forum that there are humans behind this. Beyond my role as a teacher, I am 27 years old. I am a newlywed. I just moved into a new home. I'm an only child, and I'm now a caregiver to my accomplished, beautiful, resilient medical professional 62-year-old mother who was recently diagnosed with multiple myeloma. Also, she receives treatments to hopefully put her cancer into remission. Her immune system is going to be increasingly weakened. I have no choice but to go to work, and I am extremely scared that if there is no mask mandate for anyone in this Luxembourg Casco school building, that I may contract the disease and spread it to my mom as I care for her. I am terrified that I, the only daughter, could kill her. How could I ever live with this guilt? How could I go back to work? A place I love, knowing that the people just worn masks, knowing that people just worn masks, that my mom could still be alive. With the cancer itself, I worry that she won't live long enough to see her grandchildren. If she contracts the coronavirus, we may as well give up any hope we have. I need my mom. It breaks my heart that masks have become such a political battle. No one enjoys wearing them, but they do work to slow the spread of the virus. And if science eventually shows that we don't work, or that it don't work, or that this virus isn't as bad as we currently believe it is, then there is no harm done. We are inconveniencing by wearing the piece of fabric over our faces, and we did what we thought it was right at the time based on the current science. It is also better to operate in an overabundance of caution. I respectfully and thoughtfully plead with Ms. Kinnard to change her stance on masks and make it mandated in schools. Please think of the individuals' lives, like my mom's, that could be saved if masks were made mandatory in schools like Luxembourg Casco. Thank you most sincerely for your time. The next one is from Scott Winkler. My name is Scott Winkler. I lived in Kewaunee County for 10.5 years, and I still work in the county as a teacher at Luxembourg Casco High School. I'm writing in regard to staffing and resources with regard to staffing and resources for contract tracing in the event of a spike in the spread of the coronavirus in Kewaunee County. I understand that the health department has stated that it does not have significant help for the contact tracing. I also understand that nothing has been done to address this lack of help. I would like to know what your plans are in carrying out contact tracing in the name of the public health for both the residents of Kewaunee County and for those employed in Kewaunee County. Your opposition to even an advisory for masks in the county does little to inspire confidence that you will be able to contact trace at a level necessary to protect public health in Kewaunee County. To not ensure adequate staffing and funding for contact tracing is to betray the public's trust placed in you as protectors of the public health. Respectfully, Scott Winkler. Okay, so at this time, is there any more citizen input? And I just lost my, here we go. So then we're going to move to the COVID update. Cindy, I'll let you take over.
So you've been getting the numbers regularly in the office. We have so we got one extra case over the weekend from the update that you received on Friday. Oh, well, there you go. Is that better?
Yeah.
All right, I'll start over. So you receive our weekly update or our daily update. Friday's numbers were at 107. Over the weekend, we got one more case, so it's 108. Of those 108, there are roughly 15 of them that are active cases right now, and none to my knowledge are hospitalized. A week ago, we had our second death. That death occurred in the age group of 50 to 65, and that person had been hospitalized at that time. As far as how our office is doing with contact tracing, we're doing just fine. So we have increased our staff contact tracers by 4. We have adequate funding to increase that further if needed. We have additional staff that are willing to train if needed. So we are doing just fine with contact tracing at this point. We have not needed to use the state contact tracing team that is available through Madison, and I don't intend that we will need to at all. Other than that, the big news last week for COVID was that the masking order came down through the governor's office, which makes it a bit easier than each county having an individual order on that and trying to figure out the rules and regulations between each county. So we have one order now that's come down through the state that we're all following. And my office continues to work with businesses within the community, with schools within the community, and individuals to make sure that they understand that and offer support in any way that they need. Do any of you have any specific COVID-19 questions?
Can you tell us, Cindy, the individual, the second death, what was the overall, I mean, I know HIPAA and all of this, but are you able to give us any indication of overall general health? Were there underlying conditions and so forth?
There were several comorbid conditions involved, yes.
All right. Another question. With the masking mandate, and I know that there's all sorts of hysteria and all of this and the fear shaming and so forth. And I've tried to find additional information on this with the mask effectiveness. When this all started, the CDC, of course, was advising that they weren't necessary. The mask that the vast majority of people wear that I see are the, generally homemade and simple cloth mask. I mean, I suppose a large part of that is because that's just what's available. But I know when this all started, the effectiveness, the study I saw, is that the effectiveness of those was essentially 2%. I mean, the equivalent of, complaining that your chain link fence didn't stop a mosquito from coming over from your neighbor's yard. Has there been additional studies? Is there something additional that has shown us that these masks are now more effective than that 2%?
And I can't speak specifically to every different cloth that's out there, but the masking studies right now show that if you're wearing a mask, 75% less virus can be shared with another person.
And can you give me what studies are those, where they're from?
The CDC has several of them on their website. I don't have them in front of me to quote, so,
Okay.
yep. Joanne?
I guess you can look at whatever, read whatever you want to, according to the opinion that you have, and support that. But I think it is also common sense to know that whatever you have in front of your face is blocking whatever's coming through. That would just be common sense. And also, this is not a political thing. I've been wearing a mask. Everybody knows here, I've been at meetings, you guys know, where there's 30 people in the county board meeting. And there were 2 meetings. I was the only one with a mask. So I have chosen to wear a mask for a long time. So much so that when I go home, I'm not taking my mask off because I don't even realize I have it on. It's that easy for me to wear. There are a lot of them out there. You can get the mask that feels best to you, is best for your breathing and everything. And I think the mask is, I've said it I started wearing one in March when I was doing volunteer work in Guatemala. It's over a $20,000 fine down there not to wear a mask. And those people are making $4 a day. They've been wearing a mask ever since. They have curfews. Besides Wisconsin, they have cases, but they have had a lot fewer deaths than what we have had. But all you have to do is wear this mask. All you have to do, and you will save a lot right there. So I do not understand the issue with the mask. I do not understand it. It's common sense. And you are protecting your fellow American. It is patriotic.
Does anyone else have any further questions? Kathy?
Just a personal thing. My son is a teacher in a middle school, and he has 30 students in his class. He goes, if we wear a mask, okay, kids are blowing their nose all the time. Do they have to leave the room to blow their nose? What do they do with the Kleenex? It's the more you think about it, the more issues come up. I can't imagine having 30 kids in a class, but kids blow their nose a lot. They sneeze a lot. What do they have to have another mask available? There's just all these questions out
Well, I
there.
think if they're using proper hand hygiene, Kathy, that cuts it down a lot. That's what we do during normal cold and flu seasons to start with. So if they are blowing their nose and then they are doing proper hand washing or proper hand sanitizing, that's what's going to be asked of them.
I'm just going to say a couple of things. So, first of all, I have 3 kids, and one of my kids was born with many problems. So I have been in and out of children's hospitals. And when the influenza is going on, I've had situations where my son's immune system was very, very weak. But I took precautions. We never wore a mask. I learned to do the right hygienes. I did a lot of natural things for my son to build his immune system, and I had to kind of work outside the box a little bit. I learned a lot of things. And when the influenza is going on, it's really bad for kids. There were many times precautions, things we were worried about because we knew our son's immune system was very, very weak. So I don't ever condemn anybody. If somebody wants to wear a mask, I understand. I'm not going to look at you the wrong way, but I don't think we should look at the other people that maybe have something or how they feel differently. This is America. So I feel that if you want to wear one, that's fine, but don't criticize the people that are not wearing one because they might feel totally differently or look at something differently. And the other thing is, I want to thank Cindy because I think the health department has worked very, very hard. So it's very easy for us adults to sit and say, we're going to sit in a house, we're not going to go anywhere. But 3 kids of mine are going bonkers and they need to be with other kids. They need to learn. I have one daughter who's 4.0. She wants to go to Madison. She is so smart. My son, he hit rock bottom. I didn't even know if he could pass the next grade. He needs to go to school. He cannot be homeschooled. I cannot help him. He needs educated teachers and he needs to be at school to learn. And I think it took the schools and it took the health department to work really hard to figure out a game plan to get those kids there, because that is our next future. And if they don't get any education, I hate to see what's going to happen in 3 years when these kids have to move back up. Some kids get it, and unfortunately, there's some kids that don't, and some kids just need to be at school. So I thank the health department for everything they have done, and I thank the teachers for everything they have done, and I see there's 2 sides to this, but I think we need to look at this, and everyone needs to work together on both ways. So I just wanted to say that, and thank you. Thank you, Cindy. Is there any other questions?
One more
Yes.
question. You don't have to answer this if you don't want to, Cindy, because I am putting you on the spot just a little bit, okay? But obviously, the public, this is an important topic. Going back to school, there are obviously a lot of risks to children not being in school. And, obviously, I think that there are some schools, limited, but some schools are doing the sensible thing and telling parents, hey, if you aren't comfortable with the risk, and I think that's always the way it should be, if you're not comfortable with the risk of going out in public, then stay home. I mean, hide in your underground bunker. I have no problems with that. And there are schools that are providing a visual learning option. But they're at the same time offering those that are comfortable with the risk of sending their kids to school, because it is so important. What are the risks to sending kids back to school? I mean, it seems to me that the risks are really generally low, especially when we compare the risk of kids not being in school. So can you give some type of guidance?
Well, statistically, that's
overall?
not available right now.
Okay.
We pulled kids out of school, so we don't know. We know that kids can shed the virus. We know that they carry the virus. They are less likely probably to show symptoms of it in some situations. But that doesn't mean that they can't bring it home and that others can't get sick from it. So right now we've got some summer school going on, and we have not seen outbreaks yet. So we're watching for that very closely. The schools are doing their checks and things that they need to for that. And right now, nationally, some of the schools are opening up. So maybe we'll get a better idea of what's going to happen in the upcoming weeks, But I don't think anyone has that direct answer.
Okay.
Yes.
I'd also like to thank Cindy and the Health Department for working through this very difficult times. A lot more questions than answers, and it's fluid, obviously, as everyone knows. But I'm glad that our school districts are going back to in-person classes and also making accommodations for those that either can't or are not comfortable going back to class. So, thank you.
And my knowledge of the situation is that all schools are offering a variety of different options. If there are students that have special needs, or if there are teachers that have special needs in the situation, they're working with those students and staff to do the best thing possible.
Mm-hmm. Any other questions? Okay, so then we'll move on to the July monthly report.
Sure. So
Cindy.
you all have the monthly report in front of you. We have some handwritten numbers on there because we're a week earlier than we usually are. So getting some of that is a little difficult with some of our programs. But with WIC, our contracted caseload is 218. Our monthly average is 208. And we dipped just a little bit in July down to 201. But we've still seen pretty consistent numbers throughout the whole COVID crisis. So we are working adamantly to keep those numbers up and to get those services out. And our WIC director and our registered nurse were able to go and meet with Casa Alba last week, which is a Hispanic resource center within Brown County that serves all of Northeast Wisconsin. So we were able to get some of our information out to them now so that if they're seeing people, some of those resources for Kewaunee County can be shared as well. So that's just another networking partnership that we were able to form. Other numbers on here, immunizations, they've been a little lower than usual. We're hoping to see that number go up in August with back to school. We are one of the few health departments that have continued to vaccinate through COVID. Most are not offering that service or are incredibly limited in that service. So we're hoping to see those numbers go up this next month. Communicable diseases, once again, we're off the charts there. So I'll remind you that in a typical year, we do about 200 communicable diseases, roughly. Last month, we did 1,152 case investigations. And with that being said, our staff handled that very well. I commend them for all the hard work that they're doing. We have increased our contact tracing, like I said, so it's not just Allie and I that are doing the communicable disease. We've trained Rachel Bauer, we've trained Jessica Deppes, and now we have 2 additional staff that we've brought on. So we brought on a college student for the summer, Madeline Rohr is working with us, and then we also have Mary Chris Dvorak, who is going to be helping us till the end of that grant availability. So we're doing quite well with that follow-up, and we're able to keep up very well. We had 54 confirmed cases this last month. Most of those were COVID-19 confirmations. However, we did have 2 additional cases of disease that were reported. We had 5 suspect cases, 2 probable cases, and then 1,191 that came out as not a case, which means that we get test results, we still do an investigation, and then their lab results and things help us to confirm that that was not a true case. Does anyone have any questions on the meetings, conferences, or activities that were attended or taken part in by the health department? It's a pretty extensive list.
I was like, Cindy, we got a couple pages here. How is everything going with the school? Like,
We've been meeting regularly with Luxembourg Casco right now, so we put in 6 hours at least a week in Zoom meetings with them to try to get their plan in place. Their plan will be released officially to their board on Wednesday night. Kewaunee has been working with us as well, so we've been doing some consulting with Mike Bennett and with Karen Tremmel on their plans. Algoma released their plan a little bit earlier. However, we've helped them come up with algorithms to follow. If they see something, then this is what they should do type of situation. So we've been working with Teal Van Lannen on that. So really and truthfully, I think that the schools are doing the best that they can with the situation that they have ahead of them. And like I said, the research isn't there to tell us what's going to happen. So we're just going to proceed with caution. And they all have backup plans in place if things don't work out the way that they are hoping to. So right now, I think that they're doing the best that they can.
any other questions? Cindy, then we will move to the department updates agency.
Sure. That'll be fairly short this month. So primarily what our office is working on is COVID-19. We're doing a lot of it. We've still continued with the wellness programs for the county and for the general public. So we're trying to do a little bit more programming with that. Jessica's been offering exercise sessions weekly. We've been still doing our recipes and newsletters and things that go out on a regular basis for that. We are wrapping up our prevention grant right now and preparing for the upcoming school year. Our prevention grant allows us to go in and do fun and fit learning sessions with the kids in our parochial schools. So we will be offering that again. We're preparing for hearing and vision screenings in the schools. When they're open, we will be helping with those services as well. We are preparing right now for our immunization increase, hopefully, for August and September. As we see back to school, those kids need to meet their school law requirements, so we'll be working with that. And then we've been working hard on the back to school program. So our back to school program has seen some changes this year with COVID-19. We typically have drop boxes everywhere throughout the county, every church. We have a lot of businesses. We have mini marts. We have restaurants that usually take them. This year, we had a handful of churches that were willing to take the boxes, and otherwise, we've been asking for monetary donations. We did 2 news spots. I'm not sure if anyone saw them, but WBAY and NBC 26 carried that, and we actually did very well with that. We, last I heard, had over $1,700 in donations come in just from those. So that's been phenomenal that the community has supported us in that regard. The back to school program will take place down at Lake Haven Hall on August 19th. It will be done a little bit differently. It used to be a 4-hour event where we gave people, an X number of people came within 15-minute increments. So we're going to break that down and we're going to extend it out. So it's going to be an 8-hour event. Our staff will be there in PPE, obviously. The child will be able to pick out their backpack, but then it will be filled in a hands-off kind of manner. So it'll go through, the staff will put the supplies in, and they'll be able to get some of the local resources as well. But things like the last few years, we've had the Kewaunee County Literacy Partners there handing out shoes, dental supplies, those kind of things. We've had also the HCE group that has handed out socks in the past, with some of our local churches donating to that as well, and those services will not be there simply because most of our volunteers are more elderly that help with that. So a little bit of a change, but we're still hoping to do the in-person event and do it in a safe manner. So, and we've gotten some really good offers for volunteering for that as well from some different people this year. So I think we'll have plenty of staff there helping us out, and we're hoping it'll be a good event.
That is a big event.
It is. It's a good one. So, other than that, on Friday, we received our budgeting information from the finance office. So in the next upcoming weeks, we'll be doing the budgets for each of our grants and for the county funding. I think that's kind of where we're at right now as far as an agency update. I apologize, I don't have a financial report. They come out on the 15th of the month, and usually I can finagle Paul to get me them a couple days early, but being that it's the 3rd, we're a little too early for that. So next month you will get a double report for that one.
Any questions? Then we will move to travel request and approval.
Yeah, we have no travel requests at this time.
Would you like to go on a vacation?
Gonna sneak away hopefully soon. So we're gonna try to grab a little personal time.
Overtime report.
Overtime, it just remains that Allie Martin is the only one that is receiving overtime right now, and she averages about 2 hours, maybe a week of overtime. So we've been able to keep that contact tracing down, and I cover a lot of the weekends, but with the rest of us trying to get a little bit of summertime in, so we'll see probably a little bit more overtime in August, but it's, like I said, about 2 to 3 hours a week.
Any other questions? So then we're going to go to next meeting, which I believe we already did one for September. I have down September 14th. Is that what you have,
Yeah.
Cindy and Deanne?
Yeah.
Okay. And that's okay with everyone yet, September 14th?
Yes.
So let's move to October. October 12th, we're looking at. Is that okay with everyone? Deanne, Cindy, that's good?
Yep.
Okay, so let's fill in October 12th, 8:30. And any other matters anyone would like to discuss? Then do I have a motion to adjourn this meeting?
I'll second.
A second. All in favor, say aye.
Aye.
Oppose? This meeting